worst symptom is my fear of peanuts, definitely. That's what I think about a lot of the time, and that's what I'm aware of a lot of the time when I'm out and about. I'm sort of looking around, and I seem to be expecting them to be everywhere. The other problems are my fear of any other thing that could hurt me at all. Like, I don't know, like broken glass, for example. Like, I had a watch and the battery leaked, and I got completely terrified of wearing it again, even though I was told that it had been cleaned and everything. I was terrified that it was still there and it was going to hurt me. They ruined my life. My life's completely changed. I just don't think in the same way as I used to. I just worry all the time. I'm always worried about something I might have touched or come into contact with. It moves on continuously from day to day. There's something new every day that I'm scared about. The fear with all these things isn't just touching them. Every single time it's a fear that I'm going to somehow get it in my mouth. That's the big fear. It's all right touching things, but if I get something in my mouth, that's what I'm scared of. Scared of ingesting something, and I'm scared of not being able to breathe. Hand washing, well, I do that all the time. My hands are a mess. I do that because if I think I've touched something that's going to hurt me, then just to be sure, I'll wash my hands and I feel safe again then. It's as though just washing my hands sort of gets rid of whatever could have touched them. And then I can, eat, touch my mouth, whatever, if my hands have been washed. If they haven't, there's no way I could do that. I can't touch my lips even. I get scared if I do. So I'd end up doing it all the time for fear that I've touched something.
And how often do you wash your hands?
I've no idea. All through the day. Several times an hour.
I think the background stuff is usually quite important. It gives people the opportunity to talk. People present with symptoms, but there's always a background. And also, more specifically, sometimes you can gather important information or important areas that might need dealing with.
Well, it was already my second attempt at doing the year in France. It was part of my course. And I was going to do a course at the university, and I was very frightened because I'd already had one try to go out. My dad had come with me, and I'd been too frightened, and I'd had to come back home again. I couldn't handle the thought of being there by myself, having a flat all by myself. I found a place to live, a flat with a few other people, but I didn't really know any of them at the beginning. And then this fear started really suddenly, because it started because the flat was really dirty, and I was a bit sort of disgusted at how dirty the flat was, especially the bathroom. And it started when, in the morning, I tried to always go and have a bath and come back to my room to get dressed, but the bathroom was so filthy, and the bathroom floor had mud and stuff all over it, and I always had to sort of walk through the bathroom to get back to my room. And how it started was that I always got back to my room, and then my feet were all filthy, and I thought, oh no, I have to go back to the bathroom and clean again. And I went back to the bathroom, and I had to get through this mud again to get back out, and it was a vicious circle, and I just got completely worked up about it, and I was in this state where I got back to my room and I couldn't get dressed because my feet were dirty, and I was just like, I didn't know what to do, and I knew there was a problem straight away. I knew from the moment it started that it wasn't just a little worry that was going to go away again soon. I knew that it was a massive problem that I needed to talk to someone about, but I couldn't because I was on my own in France. I just struggled through by myself and just hoped it would go away, but I knew it wouldn't. I get depressed when I start thinking I'm never going to get better. I get depressed when Gareth starts getting down about it. As long as he can cope, I'm usually just about okay. But sometimes he can't cope. And when he starts getting upset, then I just completely lose it, go to pieces. Because then there's the additional fear on top of everything else that he's not going to be able to cope with me and that his relationship's going to completely fall apart. I get really frightened at what I'm doing to him, as I'm not the person he thought I was when we first met. I've changed since then, and I want to be able to just be the person I used to be. And sometimes I think it's really unfair to expect him to want to, stay with me anymore when I'm like this. But he keeps saying that I'm going to get better and it's not going to last, and that he's willing to stick with me because he knows that it won't be forever. But I feel like riddled with guilt all the time. Because if I don't get better and he's sticking with me, then it's just such a waste for him. One evening when I was out with a friend and we were at a play, and while we were watching this play, it's really difficult to talk about, but I had a really horrible thought, and it came from nowhere. It just came into my head, just while I was watching the play and I was concentrating on the play. You're gonna think really badly of me, but I just sort of had this thought, these words, and it was "kill your mother." And I don't know where it came from. And I was really shocked and really frightened, and I wondered why I'd suddenly thought that. It's like as though I just heard the words in my head suddenly. And I just thought, oh well, strange, and then tried to carry on watching the play. But I couldn't anymore. I was thinking, why did I just think that? What a strange thing to think. And then it just got worse, and by the end of the play, I couldn't think of anything else. I was just disgusted with myself. There are things like numbers, especially doing things a certain number of times. And I just feel this urge to do things the right number of times, and if I don't get it right, then that's when I feel if I don't turn off this tap and sort of count to whatever while I'm turning it off, then I'm going to start thinking like I used to. And so I make sure I do it right. And if I don't, I come back and do it, and then I'm all right. Just little things like that, just in my daily routine. There are some numbers that I can't do. I don't know why. It was like 4. That's Gareth's favourite number, and if I do something and it just happens to be 4 times, then I'm panicked that I'm going to think something nasty about him, so I have to do more. I don't know why I associate numbers with different things. It just seems to have happened gradually.
If we look at behavioural psychotherapy, we're looking to extinguish someone's behaviour, the problematic behaviour that they're presenting with. So we're focusing exclusively on that and trying to eliminate their fear associated with the behaviour. We would do that by exploring what situations they were frightened of, get them to keep a record of that, and then gradually desensitise them through a process called exposure to the feared object or the feared situation. So gradually we would expose them to the situation, starting from the least anxious situation gradually building up to something that they feared most?
Well, to me, the most important thing seems to be to stop the latest symptoms, just to sort of be more normal. If someone's eating peanuts and they've touched, I don't know, my coat or something, so that's not going to kill me. That's the sort of thing that I need to sort out in my head. I can't see myself ever eating them in my life, not enjoying it. And I'd rather not at all.
And today's a big day because we're wanting to confront some of your worries.
Yeah.
What's been going through your mind when you were waiting to
Well,
come in?
I didn't know what you were going to do, so not that much, because I don't know what to expect.
Right, so it's all a bit of a surprise.
Yeah. I've been nervous.
Okay. So, just have a look at the contents of that.
I can't find them.
Oh,
Oh,
right.
there.
Yeah.
Mhm.
Okay. So would you have any worries eating that?
No.
Do you have any worries holding that?
No.
None at all?
No.
Okay. Hold that.
I'm not happy.
Mm-hmm.
Obviously I'd be more panicked if it was open, but I'm still nervous about it.
So you just sit there with it for a moment. And is your anxiety getting more or less?
It's just the same.
I mean, have you ever held a sweet packet with peanuts in for it?
No. Well, not since I've been worried about it.
No. So this is quite an achievement, isn't it?
Yeah. But if I was at home and I did this, then I'd rush straight to the base and wash my hands.
Mm-hmm.
Then I feel right again.
Yeah.
Feel safe.
But here you are, you can't do that.
No.
So what would be the next stage to do with this?
I suppose putting my hands in my mouth. I don't know.
Okay, well, put it down and touch your lips. And your other hand.
Okay.
And what do you think now?
Nothing. I don't know.
Okay. Touch your lips again.
I sort of feel safe here.
Mm-hmm.
I couldn't do it at home.
No.
If I did, at least I'd go around the house feeling really panicked for the next half an hour, expecting to drop dead at any minute or something.
Well, how about opening the wrapper?
No, no way. I can't do that. I don't want to at all.
Mm-hmm. So supposing I open the wrapper, that'd be a good thing to do? Okay, how are you feeling now?
Terrible. I feel awful.
Mm-hmm.
It's just really frightening me.
Mm-hmm. So you're feeling very frightened?
Yeah.
Why do you think that is? there for a moment. That'd be all right, wouldn't it? So, supposing I touched that and then touched your hand, would that be good?
That'd be awful.
Would that be the next stage?
It'd be scary.
Okay. So if I touch that
No.
and then touch your hand,
I didn't want you to do that.
no, that's okay now, isn't it?
No.
Okay. There. Now, what can you see in there?
I'm not eating it.
What can you see?
Peanuts.
Right. So, there are, you've touched peanuts.
Yeah.
Something you thought you'd never be able to do.
Or at least never without being frightened.
So you've achieved a lot, haven't you?
Yeah.
Put your lips again. Put your tongue on it. Look. Now take a bite. A small bite. Okay, another bite. Well, you've made some really good progress, haven't you? In a
Yeah.
very short space of time.
Yeah.
Well, shall we meet next week?
Yeah.
Okay.
For more force feeding.
The thing is to draw up a hierarchy of the feared situation and get the patient or the client to list a series of situations about which they were frightened or scared of or phobic of. Then you would get them to rate those situations in order. So you might list them 1 to 10. 10 being the worst, most feared situation, 1 might be the easiest situation. You would then ask the patient, the person, to plan exposure to that situation, the least one. So you'd start with number 1 on their rating scale. Get them to carry out an experiment to test their idea that they couldn't face that particular situation. And you'd get them to do that until they were confident in doing that particular one on the hierarchy. The objective and the crucial thing is to ensure that you don't start too high so that they do get a positive experience, and that's critical. So you enable them to start at a level at which they can just about do, but will push them slightly, so you're getting them to gain confidence. The pitfalls is that you can get out of your depth, that actually you start getting people to expose themselves to experiences. They might have experiences that are too frightening, and that it undermines their confidence rather than gives them confidence.
I don't really know, but if my symptoms are all due to being distressed or disturbed about something in my life, then that's really the only thing that I can think can have affected me very strongly. I haven't had any major traumatic events in my life, but thinking about it, the only thing that has disturbed me continually, just sort of gradually all the time, has just been just my whole, all the time I've been at home with my parents, just the whole oppression of it all. I've spent so much of my life feeling frustrated at home by my dad and by not being able to do the things I wanted to do, and just the whole atmosphere around the house. I've never thought about my dad and his effect this deeply before. I know that I knew before that it had affected the way I was and how I'm lacking confidence and shy and I feel as though I haven't got any kind of personality at all. I knew that, but I never thought that it had a really serious effect. I just thought that it was just really annoying and that I was out of it now. So I didn't have to worry about it anymore. It's because I'd been thinking just before. I was sort of thinking if it is more to do with the way I've been brought up, then I've got to start trying to stand up for myself. I don't really know how to, but I can try anyway. And so I tried. As we were talking, I was thinking, well, I'd sort of been thinking that maybe it's because I never stand up for myself, that partly that I'm so bad now. And while we were airing, I was thinking to myself that I've got to stand up for myself, and I can't just lie and pretend to my dad all the time just to keep him happy. That I've got to be me and develop my own personality and my own views and things, because I've not been able to up till now. And probably that in the back of my mind made me persist and be so abusive, as he said. I mean, the kind of symptoms I have don't really seem to have anything to do with relationship problems. Why it should cause me to start washing my hands and being scared of things, I don't know.
Hand washing is a complaint or a symptom that is often presented. People feel that they're going to be contaminated by something and then overwash and extensively wash their hands to cope with some sort of fear. Again, in that sort of situation, behavioural psychotherapy is useful in desensitising them, getting used to the fact that they don't have to wash their hands quite so much, and gradually decreasing the amount of hand washing.
The other half of trying to stop washing my hands, except every quarter of an hour, hasn't worked very well. Partly because I can't find my watch anywhere, so I haven't had any way of checking the time apart from going into the lounge every time and checking the clock, which is really annoying when I'm doing other things. And also just because it's too hard, because I can't do it.
What happens?
Just wash my hands because I need to, and I can't get on with the next thing if I haven't done it. I end up just waiting around for the time when I can wash them so I can carry on doing things. So in the end I get frustrated and just wash them so I can get on with things.
Commitment is applicable to all treatment approaches really, but perhaps specifically with behavioural psychotherapy, which is much more of a collaborative approach where partly it's about teaching and the person being willing to receive the information. Commitment is terribly important.
I feel as though I've lost my judgment. I used to, before this started, I used not to think about whether things were dangerous or not, and like in the garden, for example, sort of touching all the flowers and the plants and things like that. But now I can't do that because I have these niggly questions, or maybe they're poisonous, maybe I shouldn't touch them. I'd better wash my hands just to be sure. And I seem to have lost any kind of ability to judge what's dangerous and what isn't. It's like I've got to learn it all over again, and I don't know quite why I've lost that. But I try and remember what I would have thought before all this started, and how I would have dealt with something, and I can't. I just can't remember. We tried for Gareth to help me, and it was sort of semi-successful. It wasn't totally successful because there were lots of times when he wasn't there, when he couldn't be with me all the time. So there were lots of times I lapsed sort of back into my old ways. But while he was watching over me, he sort of made me not wash my hands a few times when I would have done. And since then I've tried to keep it up as much as I can, and there are some things around the house that I've touched and not washed my hands that I always used to, but there are also lots of things that I haven't managed it with yet. But I feel quite good that there are a few things that I can do that with now that I couldn't before. It's slowly starting to change, but it's not happening very fast. I feel quite pleased. I feel relieved more than anything that I'm actually managing something that I never thought would be possible. But I'm wary because I don't want to, get excited about it when I'm not there yet. I'm far from being there, and I've got to just take it slowly.